Hi guys, Gary here at Up and Running. Just going to chat to you a little bit about a condition that I see quite commonly in the clinic, which will present at the inside of the ankle into the midfoot. So as you can see here in yellow, the Tibialis posterior tendon that wraps around the inside of the ankle. We can see it fans under the midfoot. So it has a really strong attachment into the arch and has a really important role in stabilizing the arch when we're landing, and particularly through that propulsive phase, so working with the calf muscle to really generate that force through push-off. Now, you can see, just looking at the anatomy, the muscle extends all the way up the lower leg, attaching to the back of the tibia, as the name suggests, so posterior tibial. Now, you can see just with the length and size of that muscle, it does have quite an important role to play with the calf, and often it will be overloaded if there is a deficit in calf strength. So often we'll start overloading other, I guess, more accessory muscles when those larger muscles aren't sort of doing their job. But it's the most common cause of overload to this tendon. There'll be an activity component, so maybe a spike in running or walking, but I would say there's always a mechanical contribution with this type of condition. So we just don't see this with a foot that is, I guess, a more neutral or a foot that tends to rotate outwards, because the tendon's just not put under that type of strain that will cause injury. So we always see this with a foot type that tends to rotate inwards or pronate to an excessive extent. Now, if we look at a pair of feet that will often present with this condition, you'll see quite clearly the imbalance that's occurring. And the key here is to really change those forces that are acting on the foot. So we really want to make sure that heel and arch is supported in a way that's going to reduce that tension through that tendon. So you can see this is a fairly extreme example, but really highlights that imbalance or inefficiency that is going to overload that tendon that runs down the inside of the ankle here and into the midfoot. So mechanical therapies include strapping, padding, really specific footwear with an appropriate insert or orthotic. Often that is required to take that stress off, because it's such a significant amount of load that tendon has to handle. And accompanying that would be a strength plan to really make sure that those muscles and tendons, and particularly the tibialis posterior tendon, is built up its capacity to handle those higher loads. So again, it's a condition that I particularly like treating because I can apply my biomechanical skills and strength and conditioning skills, and often with really great outcomes as a result. So a little bit of insight into tibialis posterior tendinopathy. Of course, any questions around this or any other foot or ankle conditions, reach out. You can book an appointment on our website, and hopefully see you guys soon. Bye.